Hello, I'm Dr. Nalini Chilkov, the founder of the American Institute of Integrative Oncology, Research and Education. And I want to talk to you about my mission about transforming the face of cancer care by making cancer personal and by asking the question, what if every cancer patient had a health plan and not just a disease plan? Towards this end, I've taken over 35 years in private practice with thousands of patients and created an online training for first-line clinicians, Foundations of Integrative Oncology. It's an online professional training that will allow you to have the confidence to deliver health and change the lives of patients who are probably already in your practice. This course is not about treating cancer. It's about supporting the health side of the cancer equation. So I want to give you a tour of the course and introduce you to my philosophy and my Outsmart cancer system so you can see that you could implement this with patients who are searching for someone who has this kind of training. Now, we all know that a patient is diagnosed with cancer and suddenly feels like they're in an emergency, like their hair just caught on fire. The oncologist makes them feel that way quite often. And so part of our job is to say, take a breath, slow down. Let's make a plan that's right for you and congruent for you that includes planning for your health and helping you make good decisions. With this rising tide of patients who are looking for someone to care for their health along their cancer journey or to help them not have a recurrence or to not have an occurrence in the first place, by the year 2024, there'll be 19 million cancer survivors in the United States alone, and 40% of these have been alive for 10 years or more after successful treatment. These patients are not being cared for by the oncologist, and we need to fill the gap. In fact, if you didn't really have any specific training on oncology and you didn't take a deep dive into it, then you don't really have the basic knowledge to understand the primary needs of these patients and how to interface with their oncology team. So we really need some education for frontline clinicians so that we can have a voice at the table and really model collaborative integrative care. So towards this end, I created my course. So I want to show you how I think about it. So on the right, you'll see the 5 phases of the cancer journey that I think about. When someone is diagnosed, they have a unique set of needs. Then when they're in treatment, they have another set of needs, and so on to their post-treatment recovery period. And then hopefully they remain in remission and have a life beyond cancer. But today we have a huge population of patients living with cancer as a chronic illness, and they don't get much support for their health. They want to really be able to live with their cancer, have a good quality of life, a good quality of health, and the oncology team does not have the resources and tools and knowledge to help them with that. So what could we do to impact the cancer journey of patients at any point along this path, and for patients who are at risk or who are not wanting to have a recurrence? Well, we can transform their outcomes and their prognosis by putting a health plan in place. We can enhance their oncology treatments with synergistic foods, diets, lifestyles, botanicals, phytochemicals, nutraceuticals, and we can really be powerful at managing long-term and short-term side effects. Some of these will persist for 10, 20 years after someone has successful treatment. And again, the oncologist is not tending to the restoration and repair of normal healthy function. That's our toolbox. And if we provide a health model, we can help patients address this in a very powerful way. So if you think of cancer as a weed, then you can look at the soil in which that weed has arisen. Modern Western oncology is really focused on destroying the weed, but integrative oncology concentrates on the soil that weed is growing in and on making that soil as inhospitable as possible to the growth and spread of the weed. So this is how I explain it to patients, and it's a beautiful metaphor from nature. And the soil, in essence, is the tumor microenvironment, which is signaling tumor cells and signaling healthy cells, and therefore it contributes to every phase of carcinogenesis. So in the Outsmart cancer system that I will teach you in my course, you will learn how to create a body where cancer cannot thrive, and we will collaborate with the patient's other care providers to fight the tumor and nourish the patient. The nourish the patient part is missing. So I'm going to give you a sneak peek so that you can see what the course looks like inside. First, let me show you that we think about the cancer terrain, the tumor microenvironment, the soil as a wheel with many spokes. And so when I build a treatment plan and a support plan, I'm going around this wheel and thinking about, do I have something in the plan for controlling inflammation, for modulating hormones, for inhibiting angiogenesis, the ability of a tumor cell to make its own blood supply and get nutrients, grow exponentially, and then metastasize and travel to a secondary site? Do I have something that will manage blood clotting, inhibit tumor growth, regulate blood sugar and insulin, and so on? And so I will teach you this method of building a comprehensive support plan that is tailored to the patient's current treatments and current health needs, and personalize it. Part of that is learning the hallmarks of cancer. These are the characteristics of tumor cells that allow them to survive and to co-opt our normal physiology for their own ends. So, for example, a tumor cell will signal a nearby capillary to bud, and then it will make its own blood supply as that capillary buds out towards the tumor cell. And as soon as that small mass has a blood supply, now it can grow exponentially. Tumor cells are very, very smart. They can evade apoptosis the way that a normal cell would commit suicide, recycle itself, which is part of normal physiology when there's an aberrant cell. How could we turn that switch back on that is present in normal cells that gets turned off in tumor cells? And so these are some of the things that we can do. And so I'll teach you about the hallmarks of cancer and how to look at all these characteristics as well as look at the tumor microenvironment. And then we have a more comprehensive approach. Of course, we're going to talk about cancer-fighting foods and the appropriate therapeutic diets for different types of patients. And then we'll include nutraceuticals and botanicals and phytochemicals. And then I'll also talk about functional foods. And part of my treatment plan is a therapeutic shake, but we can also make therapeutic drinks and foods for people as well. I also include the use of modern Chinese medicine that is research-based and particularly focus on the tonics and adaptogens, as going through the cancer experience is extremely stressful. I also talk about how acupuncture impacts cancer care and outcomes. So I then encourage you to think about, as I do, that your patients, like mine, will be outliers. They will not be under the bell curve. They'll have different outcomes than patients who don't have a health model, who don't have a health plan. And so this is where I want to demonstrate that we can make a difference. And I've been doing that for 35 years, and I have a system, and I want to teach it to you. So frontline clinicians are crucial. There's a shortage of oncologists. Many patients will just see the oncology nurse unless they have a very complex case. They may never see the oncologist. So these patients are going to be turned back into primary care, and they should be turned back to us, functional medicine clinicians, trained nutritionists. Oncology nurses should know how to answer these questions. Oncologists should know how to refer. Internists, gynecologists, urologists, naturopaths, osteopaths. This course is designed to help anyone who is working close range, face-to-face, in the trenches, primary care with patients so that we can take care of these patients. So now let me show you what's inside the course. And I want to emphasize that it's delivered online, so you have 24/7 access. You don't have to travel. You can listen to lectures over and over again. And so when you log in, you're going to see a page that is exemplified on the left here. And there are 8 primary modules, and there are also some bonus modules that go with this course. You'll log in and you'll come to this page where you find the Foundations of Integrative Oncology course material. This will allow you to expand your practice and really become a health expert. And I will tell you, you'll have a waiting list practice because there are so few people with this kind of knowledge and the skill and the training to really take care of patients in this way. So we let the oncology team be the disease experts, and then we are going to be the health experts to cancer patients and survivors and at-risk patients. So when you click on a module, then you'll get a window like this, which will have a video that plays, and you'll see slides with references and me lecturing. And there is about 25 hours of lectures in this course. And there's also a downloadable PDF so that if you want to download all the slides and take notes while you're listening, you can do that either on paper or digitally. Also, there's a study guide, which I'll show you in a moment. And you can also download an MP3 audio file if you want to listen while you're exercising or cooking or driving or just to review the material. Every module has between 1 and 4 lectures, and we list all of the references for you. And then every single lecture also has a study guide and summary notes as well. So this is an example of a study guide. So we've put together the outline of the lecture for you, so you have something to review or even to have in front of you as you listen. And this will highlight the main bullet points, the main content of the lecture so that it enhances your learning. And if there are any slides with graphics that drive in the learning and the point, then you'll get that in the study guide as well. And quite frankly, this is exactly what I wish I had when I started. But my favorite part of this program is the live calls, which we do on a monthly basis. It's an amazing community of dedicated clinicians. And it's interesting, we have people new in practice, but we also have a lot of people who have been in practice for 15 to 20 years who never got training in this oncology cancer support territory and are hungry for it because now there's a lot of patients in their practice who are asking for this kind of help. So this is a live mentoring call. I teach a clinical pearl at the beginning of the call for about 5 or 10 minutes, and you get the slides and you get references for that. You can ask questions about the mini lecture as well. Then over the month, students will submit questions about their patients, about cases, about an herb they want to learn more about interpreting a lab or a pathology report. And then we also have case studies that are presented, and they tend to be fairly complex case studies. So as you learn the Outsmart cancer system, then you can start to build a treatment plan, and I will critique it, and you can learn and get feedback. And if you're at the beginning and just want to see how I would put a treatment plan together, then I do that. And then we post my treatment plans for those patients inside of our resource library for clinicians. So these calls are all recorded. So if you can't get on the live call, you can still submit questions and cases and listen to my answers to your questions later. And then you can listen to the call again. But we send out summary notes after the call. And we also make sure all the references are there for the call. And I absolutely love this part. You get 6 months of these calls when you enroll, and then people stay on the calls by subscription, and almost everybody has chosen to do that. So if you'd like to learn more about the Foundations of Integrative Oncology online professional training and really have a sense of being well trained and standing on solid ground and joining me in my mission, then I really invite you to be part of meeting this huge need the meaning I have gathered from doing this kind of work is the most fulfilling work I have ever done. And I would love to have you have that experience as well. So go to www.aiore.com/program-outline, and you will get to see all the modules that are in the course, and you can look around on the site. And I hope that you will decide to enroll and to join us. If you have any questions, be sure to contact us. I look forward to you being part of our community. Thank you.